February is Heart Month, so we thought we'd focus on the #1 cause of death in America, and that is heart disease. Specifically this afternoon, focusing on heart failure. The number of people diagnosed with it is increasing and projected to rise by 46% by the year 2030, resulting in more than 8 million people with heart failure. So Dr. David Rios, a cardiologist at Research Medical Center, is here now to discuss the reasons behind this rise. But I wanted to start with, what is heart failure? Everybody kind of tends to lump in heart attacks and strokes and heart failure all in one thing, but they're very different.
They are. So you have to think about the heart. It's mostly a large pump, and its job is to take oxygenated blood from the lungs and pump it out to the body so the body's tissues can meet their metabolic needs. Heart failure usually occurs when there's been an insult to that pump and it can't pump effectively and can't get that blood out to the tissues and meet their needs. Usually the insult is something specific, like a heart attack, for instance. So in this country, the most common cause of heart failure is coronary artery disease. But there are other causes like bad hypertension or arrhythmias.
So why do you think there's this prediction of seeing such a shocking increase of heart failure over the next 20 years?
Well, I think there's several causes. One is our population is just aging. People are getting older. Turns out heart failure is much more common in older patients, and they're having more coronary disease and hypertension. Another odd fact is that turns out we're treating things like coronary artery disease better, so people are surviving heart attacks, but then the consequences might be that their heart doesn't work as well because it's been injured. And then lastly, I think we're just much more, our techniques of making the diagnosis is better. And then the last probable cause is that there are certain things that are just increasing in our population, like obesity, diabetes, all these things that are predisposing people to developing heart failure.
Which leads to the answer, I think, to this question, but can we prevent it? Or what can we be doing to prevent heart failure?
Well, as I said, in this country, in the United States, coronary artery disease is probably the most common cause of heart failure.
How do we get rid of that?
Well, there are things that we can do to prevent them. So, there are several risk factors, and it's important to know those risk factors. So if you smoke, you want to stop smoking. If you have high blood pressure, that needs to be treated aggressively. If you're diabetic, that needs to be treated aggressively. And if you have hypertension, that has to be treated aggressively. The last risk factor is your family history, and unfortunately, there's not much we can do about our genes.
That much we have, right. Yeah.
And then, of course, exercise and clean living.
Yeah, so the things we keep hearing about, but
That's
we
right.
need to take them very seriously.
Yes, we
With
do.
heart failure on the rise. February is, of course, not the only time to talk about it, but we're sure glad you stopped by
thank
today
you very much.
To give us some insight into heart failure. So for more from HCA Midwest Health, go to kctv5.com and click on the Health tab. Thanks again.